A patient with TB, tuberculosis, should be placed on what type of isolation? And now tuberculosis prior to COVID was always thought of your classic example of a case where you would need to use your N95 type of mask, which might look something like this, or it might be like the duck style mask, which filters out roughly 95% of airborne particles, which are what is transmitted in a tuberculosis patient. So anyone taking care of that patient would have to wear their N95 mask, and the patient would therefore need to be on airborne precautions or airborne isolation and would alert you to wear your N95 mask in order to prevent transmission from the patient to anyone taking care of them, as opposed to any sort of condition which involves contact. Just touching the patient from surfaces could cause the disease or whatever condition they have to be transmitted from the patient to anyone caring for them, and therefore anyone caring for them would have to wear a gown or anything to prevent physically touching the patient with skin-to-skin contact. So that would be different than TB, because just wearing a gown alone would not prevent TB transmission. And then droplet would mean that it could be transmitted in the air through the particles, but not airborne in the sense that you need an N95. It is enough to prevent the spread of transmission if a patient is wearing a mask. So the patient has a mask and you have a mask, and that would be enough to filter out whatever is going through. Just wearing your typical surgical mask alone would not be successful in preventing the transmission of tuberculosis. That would not be strong enough. You would need to wear an N95 mask to prevent the transmission from the patient to being inhaled into your own body as someone taking care of this patient. And then no isolation. That's not true. We need airborne isolation for this patient. So that is why we need to pick airborne isolation. Droplet isolation and contact isolation would not be effective in the care of TB from being passed from the patient to anyone taking care of them. We would need airborne isolation to prevent that transmission.